Hello, uh, my name is Dr. Narayan Nunni. I'm a senior consultant nephrologist at Aster Medcity in Cochin. If you look at the scenario of kidney transplantation in our country over the last 5 decades, considerable progress has been achieved in terms of both numbers, that is quantity, as well as in the quality of transplants. The transplant outcomes have improved considerably over the years. This is predominantly because of an improvement in surgical techniques. Today, the surgical technique is more or less perfected, so we have very rare surgical complications, if at all. The other important development is in the field of immunosuppressive medications, which the patient has to take, which helps the kidney to function within the patient's body. We have very effective medicines which are available, which has made a difference as far as the survival of the kidney transplant is concerned. The third important factor is the understanding of the immunity of the patient's body as well as the need for aseptic precautions, which has also improved considerably. This has reduced the incidence of infections in patients who have undergone transplant, and that has contributed to improvement in survival. Say 50 years back, a few hundreds of transplants were done in our country, but today we have around 8 to 10,000 transplants a year done in different parts of the country. There are clear regulations in our country. The law is very clear as to how a transplant can be done or who the donor can be. So the government has done its role. We have people who are competent to perform the operations. We have good medications available in our country, as good as anywhere else in the world. So all these have contributed to the success of kidney transplantation in India in 2019. The main hurdles that we face in transplant are: one, the availability of donors. As far as our law is concerned, people who can donate a kidney to their relatives are parents, siblings, children, or grandparents. They are called as near relatives. This includes also the spouses. They can donate, and you need a permission from a committee of the hospital. Anything beyond that, if it is a donation which is purely based on an affection or a friendship, you need to go to a committee of the government which has to give its permission. Third group of donors are those who have had brain death, what we call as cadaver donors or deceased donors. So these are people who suffer damage to the brain following a traffic accident or following a cardiac arrest. These are people who can donate their organs because these organs are working, they are only brain dead. Unfortunately, the number of brain deaths in our country contributing to organ donation is still very small. If you take countries like the US or countries in Europe, a large number of organ donors are those who have had a brain death. They are from deceased donors. Whereas in our country, this number is still very, very small, maybe less than 5%. Now, this is an area which has to be improved. The laws are very clear on this. It's basically the attitude of people to understand this and come forward for donation from their dear and near ones who have suffered brain death. So this is a major challenge in our country. The most important breakthroughs in kidney transplant are the surgical techniques which have evolved over the last few years. Today we also have a surgical robot which can help the surgeon to perform the surgery. Robot assisted transplant surgeries are becoming very popular these days. The advantages of robot transplant is that you have very little blood loss. The blood loss is almost nil. The surgeon can see all the blood vessels very much magnified. The incision for placing the kidney is extremely small, about 5 to 6 centimeters. So this makes the patient leave the hospital much earlier. There is less pain, there is a better wound healing. So robot assisted kidney transplant is one of the major developments which has happened. The other area where we have come a long way ahead is in the availability of medications which sustain the function of the kidney and help the kidney to function for a longer time. So these are the two main areas of developments. Aster Medcity, the transplant program is run by a team of people. It's not a one-man show. We have a team of nephrologists, transplant surgeons or urologists, and anesthesiologists. Now, we work as a team, and that adds on to the benefit of the patient. We have a surgical robot, and we have surgeons who use that, and robot-assisted transplant surgeries are done regularly at Aster. We have completed about 80 kidney transplants using the robot. The other major advantage that Aster has is we are able to transplant even very young children. The youngest transplant we have done is only a 7 kg child who was 1 year and 8 months old. So to take care of small children is a major challenge. This is possible because of their ICU setup, which is an infrastructure to look after the children, and we have skilled intensivists who can take care of the children. So pediatric transplant is one of the major things that we have achieved, and we have patients referred from various places to Aster for transplants. It would be extremely helpful to the patients if the cost of these immunosuppressive medications, which are used after transplantation to sustain the life of these kidneys, if the prices can be brought down, it will be of immense help to these patients, because they need to take it for a very long time, as long as the kidney functions. So the cost is a major factor.